Prosthetic joint infections are infections of an artificial joint. The good news is they're relatively rare, but if you do 1 million joint replacements a year that are done in the United States, it's still a lot of patients who unfortunately have a joint infection. Not all infections can be diagnosed very well. There are what are called culture-negative infections. They're clearly infected, but we're just not able to get the organism.
The way we diagnose these infections is we begin by taking a sample directly from the joint itself, which is an invasive procedure. The study was conducted here at HSS, where we approached patients who were facing prosthetic joint infections. We obtained a very small aliquot of their blood, and we isolated what's known as plasma. Cell-free DNA was then isolated from this plasma and sequenced, and those sequences were aligned to a microbial genetic database. This allowed for us to identify by the genetic sequence which pathogens were causing the infection.
I think it may add to our list of various diagnostic tools that we have in our toolbox to really determine what the bacterial infection really is.